Hi, my name is Kim Mace, and I'm a faculty member in the Department of Athletic Training and Physical Therapy at Boston University. I want to thank the Athletic Training Education Journal for this opportunity to highlight our recent manuscript, The Future of Health Professions, Considerations for Competency-Based Education in Athletic Training Education. I also want to thank my co-author and friend, Dr. Kaylee Welch-Bacon, for her hard work and contributions on this manuscript. So the idea of competency-based education, or CBE, really became something that interested me when I started out on faculty at BU. And I'd find myself handing back exams that looked something like this, and these students would predictably show up in my office. And they would have questions. And I found that they would have questions on exactly 2 points on this exam. And if at any point during my conversation with them and my trying to answer their questions, I made the decision to award them back those 2 points, I found that they no longer had any questions about this exam. In particular, the remaining 10 points of material that they didn't understand fully were just not of interest to them. And this is really what sparked the idea of there needing to be something else out there. And that's how CBE really became something that I was interested in and I wanted to pursue a little bit more. Conveniently, at the same time, I was pursuing my Doctor of Athletic Training and entering the research portion of that program. And what a great time to take a deep dive into educational theory then right as you're starting the research portion of a doctoral program. So in that program, from my work there really emerged the first publication, which was in ATEJ in 2018. And we looked at educators' knowledge and confidence about competency-based education. And what we found is about 70% of educators could identify that CBE was good and that it had a purpose in athletic training, particularly with transition to practice. But only 10% of educators could actually identify CBE in practice. So 70% knew it was good, but only 10% could identify it. And that to me really is the ultimate definition of buzzword, right? Of knowing that something might have a benefit, but not really being able to fully describe it. And that really is the impetus behind this current manuscript, taking the buzz out of the word CBE. So the current manuscript has 3 purposes. The first is that we're trying to present a history of competency-based education, understanding that it's predominantly in the education of physicians where CBE really emerged and developed a place. We're also trying to define CBE. There's been a lot of proposed definitions out there that are really complicated and have muddied the waters, and we're proposing a much simpler definition in this manuscript, one that defines CBE as something that is fundamentally flexible and outcome-centric. And there's a lot of examples throughout the manuscript that highlight what I mean here and how these terms can specifically apply to athletic training education. The last aim of the current manuscript is to look at how CBE might fit into athletic training education currently. And perhaps like me, you're taking a look at these 2020 standards and thinking that your program might need some significant overhaul. And I think that overhaul, that feeling of maybe needing an overhaul, is a great time to be thinking more about CBE and about how it might fit into your curriculum programs. So I hope that you'll read the manuscript, and if you'd like to connect further, I'm happy to talk more. And again, thank you for your time.